Okay.
Are we ready?
Mm-hmm.
Okay.
Oh, sorry.
You're wonderful. You're wonderful.
Do you want me just to skip to the right
Yeah,
here?
yeah, skip to the meat. Skip the wrapper and get straight to the meat.
Reason why I kept doing the turning was because half of the picture was out.
Oh, okay.
So you might have to move it when she's at the board.
Okay.
Okay. All right. Key terminology. Make sure that you know your key terminology on each of these pages, okay? One way to understand X-rays is to compare them with light waves. There are some features of X-rays and that the X-rays and visible light have in common. Both X-rays and visible light are forms of radiation. Both X-rays and visible light can be aimed in a desired direction. There are other features that they do not have in common. Visible light can be seen with the naked eye. In X-rays, pardon me, visible light cannot pass through, invisible light can be seen with the naked eye. Visible light cannot pass through objects, okay? An X-ray cannot be seen with the naked eye, and an X-ray can pass through solid objects. Okay. I just brushed my teeth. I can't see what I'm saying. My teeth. I can't see what I'm saying. Okay. So is that clear? Does that make sense? Okay. Next slide. Woo. Okay. It's important to understand the basic process by which X-rays can be used to form radiographic images. X-rays are produced within the tube head here that's located in the tube head. They're produced in a tube. There's a tube in here that's located inside the X-ray head. As the X-rays exit the cone, the primary beam is this part that comes out of the positioning indicating device, okay? And we're gonna take a field trip in here in just a minute. We're gonna go into one of the rooms and look at an X-ray head so I can describe what's going on in there with it. Okay, when the X-rays strike a film, a latent image is produced on the film that will show the dark area when the film is processed. It will show a dark area. If there's no object between the X-ray and the film, it's going to be all dark because there's nothing in between it. This is a term called attenuation. The more dense the object, the lighter it shows on the processed film. Okay, the more dense an object. So if you have an X-ray of a tooth with a gold crown next to a tooth with a natural enamel, what's going to be wider in the X-ray? The gold crown is going to be a lot wider than the natural tooth, the enamel. Okay, so if an object such as a tooth is in between the X-ray beam and the film receptor, the path of the beam between the source of the film, some of the radiation is absorbed in the object. So the tooth is going to absorb some of the radiation. So not all of the radiation is going to get through. Okay? And that amount of radiation penetrating the film is going to be reduced. So less film here. So you're going to have a lighter area as a result.
It's like an opposite shadow.
Exactly. Exactly. An opposite shadow. That's an excellent way to look at it. Excellent. I'll have to use that. May I? Okay. After the film is processed, because before the film is processed, there's nothing, you don't see anything. Okay? After the film is processed, the area that was blocked by the object will show lighter. This contrast between light and dark areas produces images of tissue structures that the dentist uses to make a diagnosis. Okay, that's how an x-ray is produced, okay? No, that's how an image is produced, okay? Next page is on, okay, we're gonna take a little field trip here and go look at the, x-ray tube head. So you wanna pause
Yes.
everything?